Good morning, everybody. I want to welcome you guys to the 114th General Assembly, first Health Subcommittee of the year. Today is February 5th, Wednesday at 12 o'clock. So, Madam Clerk, if you don't mind taking roll. You guys recall the new system. You can put your number in and then push the button when you are ready. Good deal. Clerk, will you identify if we have a quorum?
Mr. Chairman, we have 6 members present. We have a quorum.
Thank you, ma'am. Good deal. Well, welcome again to the Health Subcommittee. I am Chairman Brock Martin, excited to be leading this group of fine gentlemen, it appears, today. We're in a brand new room as well from last year, so bigger space and more opportunity to get more folks in here, hopefully, to participate in this process. As we go about, I'm excited because this is an opportunity for Tennessee is leading the way in healthcare, guys, and we have an opportunity through this committee to really shape policy for future generations as we go. And I'm excited to be a part of that and help lead the way here. I think the best starting point, we do have a few new members that I'm seeing. So let's introduce you guys real fast, if you don't mind, to the audience possibly listening at home. Start down here with Chairman Hicks. Also, what I'd like for you to do is your name, where you're from, but then also what is your favorite exercise, as we're going to lead the way in healthcare here in Tennessee.
Thank you, Mr. Chairman. Favorite exercise. That's pretty good right there. Yeah. Tim Hicks. I represent House District 6, which is the northern part of Washington County. And I have to say my favorite exercise, because I try to do it every day, is in elliptical machine. So I really like it's easy on this old body. So that's probably my favorite. Thank you, Mr. Chairman.
Yes, sir. Chairman Hicks, or Chairman.
Thank you, Mr. Chairman. Timothy Hill, 3rd House District, part of Sullivan, part of Hawkins, part of Carter, all of Johnson County. My favorite exercise is fighting for the 3rd.
All right, I'm Dr. Brian Terry. I represent District 48, which is the eastern half of Rutherford County. And with all my surgeries and ankles and this, that, and the other, I do yoga every morning. So that would be probably my favorite.
Thank you, Mr. Chairman. Ron Gant, represent District 94, Fayette, Hardeman, and McNairy County. Before I had my accident, I used to run, 5, 6, 7 miles a day, but obviously I'm not back there yet, but I am back to walking on a regular basis, and that's where I get most of my exercise currently.
I like it. Representative Mitchell.
Yeah, Representative Mitchell. Bo Mitchell. I represent House District 50, which is Jolton, Bellevue, Charlotte Park, Goodlettsville, and part of Westmead. And I am tortured by the Peloton treadmill most mornings. Thank you.
Yeah. And Representative McKenzie.
Thank you, Mr. Chair. Sam McKenzie, District 15, which is East Knoxville, South Knoxville, downtown, University of Tennessee, and then Mechanicsville, Lonsdale, and Beaumont neighborhoods. That's in and around Knoxville College. And before I hurt my knee last week, I was, and I'm going to get back to a spin. I really like to spin.
Absolutely. Thank you, guys. And I'm Representative Brock Martin. I'm in Huntington, represent District 79. Gibson, Carroll, and Henderson counties. And my sanity is found through running. So I think as leaders of the state, it starts with us. People are going to watch what we do as well as we start to move those needles that we talked about yesterday. How can we move the needles in health? I think individual members of this General Assembly can do that and lead the way as well. So I thank you guys for taking that opportunity. A few other housekeeping ideas. I want to introduce a few of our members that will be helping us this year. Heather Asbel and Matt King will be committee attorneys. They do an outstanding job. Mike Crutchfield here with us doing the research analysis. My fantastic LA will be joining us as well. Miss Keely Frazier. Jennifer Andrade will be the committee clerk. I messed that up again. Jennifer Andrade. Yes, ma'am. Thank you. And then keeping us all safe over here, Wayne Hawk Hawkins. So thank you for him and his service to the Tennessee as well. These guys will be contributing. So we'll talk briefly on committee guidelines, and then we've got two different groups to present to us today. So I just want to read through these briefly for the committee members. Anyone not serving on the committee or the committee staff is asked to not be up in the diocese 5 minutes prior to starting. Please keep in mind that everyone will be given 5 minutes to present their bills. In the interest of time and fairness, time limits may be set on testimony relative to legislation. Parties interested in providing testimony on a bill should go to the link at the Capitol website, fill out the witness card in order to put your name on the list to testify. We will follow the House committee rules related to number of times the bill can be calendared. After a bill has been calendared 3 times without any action taken, it will be placed on a special calendar to be heard in conjunction with the final calendar. The deadline for putting bills on notice is 3:30 on Wednesday. All bills for full and subcommittee shall be turned in via the dashboard. I encourage all members to get your bills on notice, as we want to run an effective and efficient committee here this session. Health subcommittee amendments are due by 10 a.m. each Tuesday via the House Health. And then finally, to decorum for committee members and audience, this committee has been known for cordial debate and decorum, and will continue to uphold that standard. Audience members are free to hold signs, but keep them below your shoulders so not to block any others' views. Audience members are required to be in a seat, not standing. The expectation, because of the standards of decorum, is what we will not have any outburst or disruptions. And on personal orders of managing this committee, I pride myself in making sure that all voices are heard through this process. I think Chairman Terry does a fantastic job of leading his committee. I've learned that from him, of keeping decorum. We're going to keep that compassion and empathy that healthcare involves when individuals are presenting their bill or their issues. We don't always have to agree or disagree with them, but we can all at least understand that we're in the same battle to make Tennessee better. So we're going to set a standard of that professionalism and make sure that we're making the best decisions for all Tennesseans when it comes to our health. So thank you guys for this opportunity to lead you. And now let's kind of try a few practice votes to make sure this system is up and working. We've had some issues in some of the rooms, so if you don't mind, Madam Clerk, pull up the board. And we're going to take a vote real fast on if Ron Gant could outrun Chairman Terry, yes or no, in a race. That seems to be everybody. Votes are locked. Madam Chair, take the vote, please.
Chairman, we have 5 ayes and 1 nay.
Oh, yeah. Good deal. Representative Gant wins. Good job. Perfect. Without objection, we will go out of session for presentations. Perfect. Our first presentation today will be from the Department of Human Services. If you guys don't mind coming forward, your mics will be controlled from up here, I do believe. State your name for the record and welcome to the committee.
Mr. Chairman and members of the committee, my name is Clarence H. Carter, and I am honored to be the Commissioner of the Tennessee Department of Human Services. And I am joined here today by our Assistant Commissioner for Public Information and Legislation, Callan Baggett, and our Legislative Liaison, Paige Foster. Pleased to be here with you this morning. So we wanted to begin by showing you our spaghetti picture. And what that represents is 80 of the 105 programs that are federally authorized to administer support to vulnerable Americans. Okay. Now, we administer in DHS about 8 of those. Okay, and we will get more specifically into those. But I share that with you to share with you the absolute dysfunction of design and operation of the safety net. And what we are doing here under Governor Lee's leadership in the Tennessee Department of Human Services is beginning with the notion that Tennesseans that need these supports, they don't choose to live a life of needing those supports. And so we ought to be intentional where possible about helping to lift them beyond the need for those supports. And so in our department, we are guided by the notion of growing capacity to reduce dependency, to strengthen Tennessee by strengthening Tennesseans. Okay, as I've said, I just want to give you some perspective on the department overall. We serve over 2 million Tennesseans on an annual basis and have at least one office in all 95 counties. We administer multiple programs across state government to grow an individual's capacity to reduce dependency. We have multiple buckets, but today I'm going to focus on what will appear before your committee here in Health Subcommittee the most. Our first big bucket is our Family Assistance Division. Within that, I'd like to first talk about the Supplemental Nutrition Assistance Program. The SNAP is the acronym, and I would tell you, as a person who administered this program at the federal level, when we changed from food stamps to SNAP, 22 years later, everybody still calls it food stamps. This is formerly known as food stamps. We are charged with issuing payment assistance via an electronic benefits transfer card for nutritious food purchases. This is a program administered within the United States Department of Agriculture, and we are the state entity that administers this federal program. Our customers' eligibility is determined by factors like income, household size, residency, employment status, amongst other requirements. Another important piece of our family assistance is our Families First program, which is what we call the Temporary Assistance for Needy Families program in Tennessee. TANF was established in 1996 as a workforce development and employment program focused on gaining self-sufficiency through employment. Tennessee receives a block grant in the amount of $191 million each year to cover the TANF program. In my previous role as director of the Office of Family Assistance in the federal government that oversaw the TANF program at the federal level in President Trump's first term. TANF works by providing temporary cash assistance, transportation, child care assistance, educational supports, job training, employment activities, and other support services to Tennesseans who meet the eligibility requirements. The simplest way I can describe TANF eligibility is that an individual must be low income and have dependent children. Also, an important factor to emphasize is that TANF customers can only be on the TANF program for 60 months in a lifetime because it is called temporary assistance for that reason. A conversation piece that has received a lot of attention in recent years is our TANF reserve. Tennessee had the largest unexpended reserve in the nation upon my arrival. Because of the partnership between the administration and the legislative branch, my first year here, you passed the TANF Opportunity Act. TOA created a spend down plan to obligate the reserve, and I can tell you that every dollar has a name to it. As you can see from this slide, the reserve is fully obligated and will be expended over the next 2 to 3 years. And just a quick explanation, when we say obligated, we do this through contracts with service providers. And And so we will have a contract with a service provider to provide X service. And let's say that overall contract is $5 million over a 3-year period. Well, the dollars are not considered expended until the contractor spends it. The fact that we have made the contract it only obligates the funds, it doesn't expend it. So that $740 million unexpended balance, it will come down gradually over the next 2 to 3 years as the contracts expend the dollars that we've obligated. Moving beyond family assistance, our department also is the state recipient of the Child Care Development Block Grant, and therefore is charged with planning, implementing, and coordinates activities and programs to ensure quality and the health and safety of children in licensed child care facilities. Child care is obviously a big conversation topic. We're incredibly proud of the work being done by DHS. We really view child care as a three-legged stool. The first leg of that stool is we help parents by operating the Child Care Certificate Program, which is a subsidy program for low-income working parents to put their children in a safe and healthy place while they go to work. We've seen increased enrollment. Second, we support child care providers by issuing different grants and technical supports across Tennessee. Programs like our enhancement grants and our nonprofit employment partnerships give child care agencies assistance. The third leg of the stool is we also have really moved into the space working with employers, like our work with Tyson Chicken in Humboldt and ORNL in East Tennessee. Government cannot and should not do this alone. Employers have insight to what their employees need and can help achieve that. We appreciate our business partner in this regard, and I would tell you that we work daily to actively increase these business partnerships. We have been able to strike a spirit of mutuality with the private sector to say that, not only does the government have a role in this, but because this is a support to your labor force, that you also have a role in this. And so we actively work with the chamber and the private sector on these partnerships to build and expand childcare in Tennessee. Because of time, I'll switch to the next slide briefly, but briefly describe the remaining programs in our department. Child support enforcement. We are the agency charged with enforcing child support orders for 4D cases. Our job is to utilize the tools made available to get the dollars to custodial parents. And in addition, we look to build the capacity of non-custodial parents to meet all of their obligations, not only the economic, but the social, emotional, and developmental obligations of non-custodial parents to their children. Our Division of Rehabilitation Services works to get people with disabilities back to work through our many different programs within vocational rehabilitation, whether that's through our work at our Tennessee Rehabilitation Center in Smyrna, or through our vocational rehabilitation counselors. The work of our DRS team does is truly inspiring. Finally, our department oversees the Adult Protective Services. This unit is charged with investigating reports of abuse, neglect, or exploitation of vulnerable adults in Tennessee. Mr. Chairman and committee members, thank you for the time, and we look forward to working with you during this session.
Thank you, Commissioner and team, for a great presentation. Members, any questions? Chairman Terry.
All right. Thank you, and appreciate you for being here. And I just, to educate us, we've obviously been out for a while and we're back up here. So for TANF, can you describe, what it can actually be, what categories they can be spent on, so that we know how it can be used. And then to your point, my understanding is it's essentially a recoupment grant. Like you're saying, you have it dedicated. It has to be spent. It has to be spent on whatever it is, the 4 categories or whatever.
That's right.
And then you get to recoup that at the federal level. So that's a process that you guys have to go through.
Chairman, that's accurate. And let me take the second question first, and we'll back into the first one. So yes, TANF operates as a reimbursement grant from the contractor's perspective. We get on October 1st of every year, we get, well, by quarter, we get access to $191 million, which is the annual grant. But when we contract with an organization to provide a service, that is then it operates as a reimbursement grant. So you provide the service, you invoice us, and then we reimburse. So that's the way that that operating mechanism works. And so once deemed eligible, the low income family that has dependent children, the main expenditure item is the cash assistance. So of that $191 million annually, we budget and expend about $65 million annually, on which is just the cash grant to the family. Now then, again, through our service providers, they can provide all manner of other services that intend to support that family growing towards greater degrees of self-sufficiency. So there's just a large number of family support services that we're able to provide through that TANF grant under those 4 categories.
Representative Chairman Terry, you recognize.
I was just going to have you guys tell us about the 4 categories, and then to clarify what you just said, the 190, we're doing 65 on SNAP.
No, 65. That's on cash assistance. That's
separate
from SNAP. Okay.
Yeah, excuse me. And then because I've always had in my head, we had 120 or somewhere around that left over, and then we were trying to figure out how to utilize that.
That is correct.
That's correct. Okay.
Yes.
And if you can give us the categories.
Okay. And so the four categories are anything that can support the establishment of 2-parent families. It is to reduce the instances of out of wedlock pregnancies and births, to help ensure the securing of 2-parent families. Okay? And the 4th is to end the dependency on government supports of those low-income families.
Chairman Terry, recognize.
Yeah, thank you. And you keep
Please.
stuff's slowly coming back.
There you go.
So are there like 9 subcategories, or are there other maybe?
So if I could, let me just.
Because those are obviously very broad. And
Okay,
my point being is that there's things that these can only be spent on, and it's a careful process.
That's correct.
Yeah.
And let me just touch those again. Transportation.
Yeah.
So that family would need transportation to you. Transportation, childcare assistance, educational supports, job training, employment activities. Those are the kinds of other, if you would, subcategories that those dollars can be expended on.
All right. Thank you.
Representative McKenzie, you're recognized.
Thank you, Mr. Chair, and thank you all for coming in such a good, informative presentation to someone that's new to this committee and not necessarily to the work that you do. To kind of dovetail on the previous question, so that's kind of how you're spending the incoming 190, 191, whatever that is. In terms of, you all, for whatever reasons, you end up with a large cash reserves. those funds, are they going out at that 65-35 split, or are you spending more of those cash reserve funds on other programs and not a direct cash dispersal to the needy families?
Thank you for the question, Representative McKenzie. And I will give you an example. So one of the things that the TANF Opportunity Act authorized was some pilot demonstrations that would allow us to test ways to better use TANF, with the objective to using the results of those pilots to determine how we would collectively retool TANF. So we obligated $140 million of the reserve to fund those 7 pilots. So was $25 million from the reserve dedicated to each of the 7 pilots. So that was a way that we used the reserve. Okay. In other ways that we use the reserves are things like we developed a relationship with legal services so that we can provide legal services for TANF eligible families, because one of the things that we found very clearly is that many of those that we served, they suffered with challenges that had legal implications, and of course didn't have the resources to be able to deal with those. So we built this relationship with TALS to do that. So those are some of the kinds of things that we've done with the reserve that are different from what we do with the 191 on it.
Thank you.
Yes, sir.
Any additional questions from the committee? Nope. Representative Gant, you're recognized.
Thank you, Mr. Chairman. With the new administration in DC, do you foresee any changes with any of this going forward, or have you heard of any possible changes of any of this?
Representative Gant, appreciate the question. And if anyone has been awake for the last 2 weeks and doesn't expect some seismic change in everything, then I think that they've been asleep. Okay. There will be, at time, I am certain, some very significant proposed changes to what we do in this broader safety net space. And we have had our team simply monitoring all the executive orders, okay? And having their ears to the pavement as folks populate this new administration to see what the walls are saying. But we know change is coming.
Okay, thank you, Mr. Chairman.
Chairman Terry, you have a question?
Thank you. Could you explain a little bit of the CCDF?
I'm sorry?
The CCDF, Child Care Development Fund.
So the,
Can I walk you
please,
through
go,
that?
Callan, please.
You know, I can't go through a presentation without speaking. Callan Baggett, Assistant Commissioner for External Affairs. So the Child Care Development Fund grant is a roughly $300 million, fluctuates, that the federal government provides to us through Administration for Children and Families Child Care Program. 70% of that grant has to be used for the subsidy program, what we call certificate or what we call Smart Steps in Tennessee, to make sure that parents can drop their kids off at a safe place to have their children watch while they go to work. So that is, you'll hear a lot of folks talk about our Smart Steps program. That is part of that program. It also provides, with the remainder of that block grant, we are able to provide grants to providers. You see that through our enhancement grants or our expansion grants. You've seen that you all put some state dollars into that recently in the past 3 years with the Child Care Improvement Fund. But those enhancement grants are made to bolster the facilities of existing childcare providers or new childcare providers to lessen that burden. We also use those grants, like Commissioner already referenced, for example, with the Tyson Project. We came in, I think it's really a good way to show all that we can do in this space. Tyson approached us and said, we want to do something for our employees in childcare. And we, over a period of 4 years, refined what that looked like. We used enhancement grants to, Gibson County donated the land to Tyson. Tyson put up the money for the capital expenses because CCDF cannot be used for capital. And then we looked at enhancement grants for the childcare provider that operates it. I think it's contracted out to a childcare provider. And then we did a registration fair with Tyson employees to see if they were eligible for our Smart Steps program. We went on the ground and registered folks and said, we'll help you pay for your childcare. So that is a really holistic look. Now, that's one model. We've seen different models throughout the state, and we'll be happy to talk about ad nauseum. So.
And if I could just add, what that showcases is, Governor Lee says almost every time I hear him is that the government can't solve our most complex problems by itself. It takes all of Tennessee to do that. And it is important to us that we engage all of Tennessee in this very important problem, okay? Parents must have a healthy, safe, and educationally appropriate place where they need to have their children when they have to do the other elements of life. And so we take it as a core responsibility of the Department of Human Services to help to provide that, but to engage all of Tennessee in how we go about providing that.
Yeah, to your point, that is a great example, and that was what I wanted the members to understand is it's not for the infrastructure, but you can, for those that are trying to better themselves, and of course the term's pathway to prosperity, if you can get the items that can help them in that facility, but then also expose them to the wraparound services and get them connected that way, that's how we can utilize these funds to, like I said, make people more prosperous, and it helps all our Tennesseans. And so, great example. Thank you.
Thank you, Chairman. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. Mr. Commissioner, has the new administration been disruptive in you being able to provide assistance to needy Tennesseans?
It has not. There was the briefest of hiccup last Monday evening and Tuesday morning as that hold was put on. But what was clear about it is that there was not one dime of disruption to any Tennessean that gets direct cash support. Okay, the brief hiccup for us was an inability to draw down some of our administrative dollars. That all lasted for about 12 hours. But before the end of the day, I think on Tuesday, all of the systems were back operational. And so we saw, other than a few sweaty palms for a few moments, we saw no disruption to our system.
Representative Mitchell.
Yeah, thank you, Mr. Commissioner. So once the states told those people what they were actually doing was harming people, since they didn't know what they were actually doing, y'all had to inform them, you can't do this or you're going to harm people. That's when they figured it out and turned it back on. Thank you.
No. If I could push back slightly. No, sir. From the very beginning, the initial orders were not to disrupt the direct payment. Not to just, and we had not one instance of a direct payment to a Tennessean that was expecting a SNAP benefit, a TANF benefit, a child care benefit, not one penny of disruption there. As I said, we had that very brief hiccup where we could not draw down an administrative dollar, but that literally happened for 12 hours. Okay, that got all squared away. And so the any disruption to us was de minimis.
Thank you, Commissioner. Any further questions from the committee? Not seeing any. That Tyson that you mentioned is in my district, so I'm very proud of that, and it's getting fantastic reviews from the employees, and we're seeing life-changing improvements in those individuals' lives. So we appreciate that example, and thank you for what you're doing, and thank you, team and Commissioner, for your work in that field. Thank y'all.
Thanks so much.
We will stay out of session and introduce next up will be the Health Facilities Commission. If you guys don't mind coming up front, stating your name for the record, and welcome to the Health Subcommittee.
Is this on? Excellent. Good morning, members of the Health Subcommittee. My name is Logan Grant. I'm the Executive Director of the Health Facilities Commission. With me is Caroline Tippins, our Director of Licensure and Regulation. We really appreciate the invitation to come here, introduce ourselves, and tell you a little bit about what we do. So for those of you who, members who may not be aware, we are a relatively new entity. Prior to July 1, 2022, we were the Health Services and Development Agency, which is an independent commission which was responsible primarily for the Certificate of Need program. And through the Certificate of Need reform legislation that was passed prior to that, the CON working group put together a plan that would integrate the licensure and the Certificate of Need components of healthcare regulation in the state into a single entity. And that resulted in the Health Facilities Commission. So not only do we do Certificate of Need now, but we also do licensure. We send out surveyors for complaints. We do recertifications and a host of other associated duties. As you can see, we, in addition to conducting surveys, one thing that we kind of want to focus on today is how we're doing in the field of long-term care, because there's a lot of work to be done in this area. We go out and respond to complaints from anybody who files one with our agency, and we will go out to the assisted care living facility or nursing home and investigate that complaint. And we do that as the state survey agency for CMS as well. So not only are we enforcing state law, we are also enforcing federal regulations. I'll turn it over to Caroline to go through the complaint intake process and some statistics on how we're performing.
Good afternoon. So absolutely, we can receive complaints from any sources. They can be received from members of the public, the community, staff members from within the facility, other external departments, law enforcement, our friends at the Department of Human Services, Adult Protective Services, and many other avenues. They can be received via fax, via email, and via our dedicated complaint hotline. So the folks that are employed in our dedicated complaint hotline are registered nurses who triage the complaint based off of the severity of the allegation. We have many different types of complaints, which would be non-IJ, IJ being our most severe, and non-IJ high. So there are different timeframes in the state operations manual by which we have to go out to a facility and do a complaint investigation. And that determines, once that's entered into our system, it's sent to our regional office for triage, and that determines how quickly we can send a surveyor or a survey team. Depending on the number of complaints at a facility, we may send one surveyor, or we may send multiple. If you want to go to the next one. So there were changes made by CMS to the State Operations Manual, which governs us as the CMS State Survey Agency back in October 2022. They changed Chapter 5. As a result of that, that resulted in a 63% increase in complaints to the state of Tennessee, a tremendous complaint volume. And so that resulted in a backlog of complaints, and that sort of pushed our recertification numbers down. As you can see here, the complaints that I mentioned, IJ is in blue, non-IJ high, and non-IJ medium is in gray. We started off in 2022 with a high number of immediate jeopardies, which would be our most severe type of complaint. But through re-educating our staff, we have decreased the number of immediate jeopardies, and presently seem to have more non-IJ high and non-IJ medium specifically than we do immediate jeopardies. And we're working on a way to specifically build out a unit and work within our departments on how to address these immediate jeopardies, because they are our most severe complaints. So In 2024 alone, we received 3,703 nursing home complaints. Of these, 44%, 1,618, were triaged as either an IJ or a non-IJ high. We only have presently about 309 nursing homes in the state, 294 of which received at least one complaint, and 128 of these facilities have over 10 complaints on file for a year. Last year alone for nursing homes, we investigated 2,353 complaints and found that over 54% of those allegations were substantiated after investigation for a total of 1,273. 213 nursing homes have at least one complaint that was found to be substantiated after investigation. So what does this look like and what does this mean for you? Well, generally speaking, we hover around between 5 to 10 top-cited deficiencies. And as a nearsighted person, I need some reading glasses for this. So our top ones, we have resident patient client rights. Right now, that is our top deficiency at 3,384. Secondarily, we have quality of care and treatment, followed by nursing services, and then resident patient client abuse and administrative personnel. And as you can see, the graphic representation, we had that change as I referenced earlier to Chapter 5 about complaint reporting. As you see, that number in 2023 and 2024 jumped greatly. So that explains those increase in top-cited deficiencies as we were receiving more complaints.
One thing I'd like to add on to that is some folks may look at this and be alarmed by the increase in complaints and wonder whether or not this indicates a reduction in the quality of services that are being received. And we just like to point out that the number of complaints that are actually substantiated are well within historical norms.
Mm-hmm.
So we don't think that this reflects in any way diminished quality of services across Tennessee, but rather it's more complaint investigation for our staff.
Mm-hmm. And the number of complaints have risen nationwide as a result of the change to Chapter 5. So I think that that's an important consideration to remember. So we have issued 1,320 total federal citations to nursing homes. As I mentioned, our top health-related deficiencies were infection prevention and control, making sure patients were free of accidents and hazards. Food storage remains the top complaint, as of being free from abuse or neglect and reporting of alleged violations. We also have not only health, but we have life safety. Life safety deals with like essentially the physical plant of the facility, sprinklers, ceiling tiles, fire alarm system, electrical systems. So our top cited deficiency there will be the sprinkler system and making sure that it's appropriately maintained and tested, followed by the fire alarm system testing and maintenance, electrical systems, maintaining of those electrical systems, and then cooking facilities and hazardous areas, making sure that there's no jutting pipes, et cetera. And so those have been pretty standard year to year, as you saw on that prior chart. So as you can see from 2024 is what you're seeing here. We did have an increase in 2022 in infection prevention and control. And part of that was CMS had implemented focused infection control surveys. So there was an increase in infection control at that time. But generally speaking, as we move from 2022 into 2023, the numbers have decreased and then have in fact remained stable and decreased in some categories. As you see from 23 to 24, a lot of our food procurement and storage has decreased. And as you see from reporting of alleged allegations, that has essentially remained stable. I wanted to note that we have worked with providers in providing training on our top cited deficiencies. We actually did a long-term care training for all of the long-term care facilities back last year, and we have also had some changes to the state operations manual this year, and we went ahead and did training in December 2024 about that as well. So we continue on maintaining our focus and educating providers about our top-cited deficiencies so we can reduce those numbers and ensuring that we are transparent about what we're doing.
And with that, another thing I want us to touch on before we move over to the CO1 reform, we understand that there's one thing that we're working on is trying to address the recertification backlog that we have in the state of Tennessee. Nursing homes are required by federal regulation to be recertified by the state survey agency once every 15 months. Mm-hmm. And we are pretty far behind on that. And a lot of that is because we've been required to divert more staff towards complaint investigation because of the changes to the Chapter 5 of the State Operations Manual by CMS. So in addition to changing how many complaints we received, there's also certain metrics of performance that CMS evaluates, which determine our federal funding. And if we do not, and they prioritize the complaint investigations over the recertification survey. So if we do not meet our metrics on complaint investigation, we stand to lose federal funds. And those federal funds from CMS have not been increased to allow us a greater workforce in 15 years. And I would also note that our surveyors are required to be licensed healthcare professionals and are primarily registered nurses. So it's a very competitive labor market for us. And so that's kind of where we find ourselves. But we do have some strategies that we're working on to try and address this backlog. Particularly, Caroline's done a great job trying to focus on creating dedicated complaint intake staff so that when we get a complaint, for example, an immediate jeopardy, that has to be investigated within, I believe, 24, 48 hours.
Yes, sir.
And so that can be disruptive towards our recertification schedule because we schedule these things out months in advance. So if we have to take folks off of the recertification survey to go deal with that, that's how we get our backlog. So all that to say, we have requested in the budget to some additional staff to create a statewide high priority complaint investigation unit, which we think will really help us stick to our recertification survey schedule. Happy to answer any questions about any of that before we move on to CON reform.
I think we do have a few questions on that. Representative McKenzie had one first. I know you're up, and then Representative Williams, and we can move on.
Thank you, Mr. Chair. And again, thank you all for coming today. You had talked about the immediate jeopardy numbers took a dramatic decline, but you attributed it to staff training. Are you saying that prior to that, your immediate jeopardy were not immediate jeopardy, they were misclassified, there were no immediate harm or potential harm, or that your training has made those numbers go down in the actual life of a person in a nursing facility?
Yes, sir, the latter. So it wasn't that the staff were mistrained. As I said, CMS changed the priority in how they handled immediate jeopardies and also released some new training and new guidance. And they've also released some new, what they call QSOs, again, this year, changing how immediate jeopardies are handled. And they're changing some of the language from the probability of harm to the likelihood of harm. So that being that is a different standard, essentially, our staff had to be retrained and re-educated about the differences in that standard, and they released additional training and guidance. So we wanted to make sure that we were doing everything consistently and in line, and took a deep dive with our staff as to how that was done.
Representative McKenzie, you're recognized.
Thank you. So again, so what you're saying is there were no, and I'm not saying this as a negative, there were no behavioral changes in how staff manage their clients, patients on a daily basis. It was bureaucratic in how we define.
Yes, sir, the prioritization.
Thank you.
Representative Williams, you're recognized.
Thank you. Appreciate your hard work. I know, Logan, you came to visit me, or Director, you came to visit me a day or so ago. Maybe it was yesterday. Days were running together. We had a frank discussion really about recertification, the importance of it. I guess the challenge is it sounds like our focus has been on the complaints because we're losing federal dollars if we don't respond to those complaints. Meanwhile, it's become the priority because of that. Right now, I think a little over 60% of our nursing homes are the federal standard is 15 months, I believe. And right now, more than almost 2/3 of our facilities are not even getting it done at 15 months. And so my question is that how come we haven't gotten federal dollars withheld for not doing the recertification process within that window? I mean, it seems like we feel the threat on one side, but we don't on the other, but the threat is real.
Mhm.
My assumption is the threat real if we don't get recertification completed?
Mhm. That is true, and it's not just Tennessee that's been affected with a backlog of recertifications. It's affected all states in the United States. Presently, 48 states are under corrective action plans with CMS for that metric. By the changes in Chapter 5, that drove the number of complaints, and that forced many states like Tennessee to try to prioritize the number of complaints or work them into the recertification process. I will say, Representative Williams, we did accomplish 94 long-term care recertifications last year, in addition to doing over, 3,900 complaints, which was a 27% increase from the year prior. So we have greatly increased our bandwidth in terms of engaging in complaint surveys and doing recertifications. Part of that was we've strategized in filling our vacancies. When we took over in 2022, we had a 28% vacancy. I'm happy to say that as of January 2025, I have a 5.4% vacancy now. We've restructured our positions and the ability to hire not only registered nurses, but licensed practical nurses and social workers as well. And we've also moved our staff to mobile workers to help them to travel more freely throughout the state and not be office-based. So we have made an attempt to fill our vacancy to, number one, increase our ability to address recertifications, and number two, to increase our ability to take complaints and recertifications out together. And then by creating that new complaint unit that we're focused on, that will free up more surveyors that are on normal teams to go out and address that backlog of recertification.
Yeah, one more. Just the concern I guess I have is that it's almost like we're chasing the fruit instead of maintaining the tree. I mean, a lot of these complaints could be because we haven't recertified a facility. They haven't, and those complaints are the byproduct of us not doing that. And I can appreciate the fact that you're doing more than you were doing the previous years, but still, it's much like other states, it's woefully behind. And so I would like to know, as you go forward dealing with complaints, if you're able to at least look back at the recertification and see, when was the last time this facility has been recertified? As somebody's grandmother spent some time in there, a lot of the complaints are driven because the facility is not maintained well, it's not clean. A lot of those complaints could be because the recertification process is not there. So I don't know that sometimes our focus is, as I said, on the fruit, not the tree. But to me, it seems like because the federal dollars are in jeopardy for both, that we should be focusing on both and not one or the other, because we are going eventually, those states like us, most of which are southern states, to be frank, are not keeping up with the demand as it relates to recertification, because their constituents and consumers need to know that the facilities that they're utilizing meet the standard, not just federally, but our state standard as well. So thank you.
Thank you, Chairman. Any other questions in regards to that topic at the moment? Not seeing any. You want to move on to CON component?
Yes, sir. Thank you, Mr. Chairman. Additionally, we're working on implementing Public Chapter 985, which was the Certificate of Need reform legislation that was passed last year. As many of you know, what that did was set up a process over the next several years by which certain services will be taken out of CON regulation and instead will be moved in through licensure. And in that process, we'll be establishing quality standards that folks will have to meet in order to become licensed to provide those services. And so we are starting in this year by forming some technical advisory groups. With that, we've reached out to all stakeholders and formed some groups of providers with expertise in these various areas. And we've been very, very impressed, and we're very grateful for the amount of time and effort that they put in to help us develop these standards. Our first technical advisory groups have been for NICU, burn units, and MRI and PET, which are scheduled to move from Certificate of Need regulation to licensure with a quality component on December 1st of this year. Our board will be meeting later on this month, and we'll be promulgating rules we'll be initiating the rulemaking process for these quality standards as they've been proposed by the technical advisory groups. And so we're very eager to get some public comment on on those recommendations from the technical advisory groups. The legislation also created a carve out for freestanding emergency departments that will take effect on July 1 of 2025. And that will be for folks who want, providers who want to put up a freestanding emergency department that is more than 10 miles away from an existing freestanding emergency department or actively licensed acute care hospital. And we're going to be rolling out how that process is going to work by the end, certainly before the end of the month. So, and this slide here kind of goes through what the timeline is for that transition from certain services from CON to licensure. Obviously this year it's those that I mentioned, and then in 2027 we'll have ambulatory surgical treatment centers, linear accelerators, and long-term care hospitals. And then finally in December 1st, 2029, open heart surgery services will be moved from CON to licensure. So we're eager for these initial exemptions to be a success and to build on that success. And I think that the technical advisory group model has been very beneficial in that process. Happy to answer any questions.
Thank you, sir. I believe Representative McKenzie has a question. You're recognized, sir.
No problem. Thank you. Thank you, Mr. Chair. I guess one of my concerns, I guess let me ask a quick question, is the linear accelerator types of treatments are fairly expensive, correct?
Yes, sir. The machines are very expensive.
Yeah, and that translates to the end user. I guess one of my, concerns is taking away that to me would be a good candidate for a certificate of need, since it's such a specialized treatment and, not necessarily widely used like an X-ray or a general MRI scan. It's orders of magnitude more expensive than those types of treatment. Wouldn't that be something that we need to kind of keep our eye on? Honestly, I don't see it coming into a rural county where you don't have the expertise of the staff to operate and maintain that. That's kind of something that, and you're not going to have the need for it because you really need to, it's a numbers driven piece of equipment, right? In order for it to pay for itself. So that's something that I would think needs some kind of evaluation. And conversely, you don't want too many of them in Nashville, because there may not be a need for 5 of them here, So just trying to understand the logic of how you all in general pull things out of having a certificate of need and keeping some things in.
Yes, sir. It's a good question. We supported the legislative CON working group, and that was composed of members of the House and Senate. And it was their negotiations that set the, which services were going to be removed and on what schedule. So our commission has really had some more of a neutral and supportive stance of whatever the General Assembly decided was the best avenue. So but I can tell you, some of the public policy intention there was that I heard discussed was, well, because linear accelerators are so expensive, they are generally, if somebody's going to make that investment, they're going to know that they can make enough money on it with the patient base that they have. So I think that was, I think they looked at linear accelerators as something that kind of has a built-in barrier to entry by the cost of the initial investment.
Good. Any further questions? Not seeing any. I thank you guys for participating and coming in today. I think Representative Williams brought up an important point that we talked about yesterday, is making sure these certification components are sped up. That's important to my district. I hear that when I went and toured my facilities this year. So I appreciate what you are doing. And it looks like we're hoping to make that a priority as we move forward too. So thank you guys for that work. Representative Williams.
Thank you, Chairman. Just as a follow-up on the recertification, if let's say at NHC in Cookeville, Tennessee, there's a complaint, and yet they're up for recertification, do you do a recert while you're there doing that at the same time?
Yes, sir.
Okay.
Yes. What we try to do is we would work the immediate jeopardy complaint. And then if there's lower priority complaints, those would be worked through the long-term care survey process during the recertification. So it would be combined.
To be clear, I just use them as reference. There's not a problem there. Thank you.
Yes, sir. Understood.
Any further questions? Not seeing any. Thank you guys for participating. We'll go back in session.
Thank you.
We're back in session. Any personal orders or agenda items to be added? Not seeing, Representative Mitchell, you're recognized.
Yeah, Mr. Chairman, is this your first time chairing a committee?
Yes, sir, it would be.
Well, I just wanted to say you did a very fine job today on your first run of the show. I just wanted to commend you on that.
Thank you, Representative Mitchell. I appreciate that. No other orders before us. We stand adjourned.